Okay, my name is Danette Villarreal. I'm going to be doing a head-to-toe assessment on Mr. Villarreal, and let's begin. So I went ahead and I've done hand hygiene. I washed my hands, and I have my gloves and all my supplies, so I'm ready to go. So, knock, knock, knock. Come in. Hello, Mr. Villarreal. I'm going to be your nurse today. My name's Danette, and I'm going to be performing a head-to-toe assessment on you and asking you a few questions throughout this assessment. Is that okay with you?
Sure.
Okay, good. So first, do you have any concerns you want to address prior, anything bothering you in
No.
particular, or areas of tenderness I should know about?
No.
Okay, great. So why don't you start with telling me your first and last name?
Mark Villarreal.
Okay, Mr. Villarreal, what's the last four of your social security?
1, 2, 3, 4.
Great, and then can you tell me what day of the week it is?
Sunday.
Great, and who's our president today?
Trump.
Trump, that's right. Okay, so patient is alert and oriented ×3. And then also, so now I'm going to go ahead and do vitals. Mr. Villarreal, before I get started with it, I'm going to ask you to memorize three words. And then at the end of the exam, I'm going to ask if you could repeat those back to me, okay? So the first word I'm going to ask you to memorize is pen.
Pen.
Second word is cat.
Cat.
And the third word is boat.
Boat.
Yes.
Boat.
Yeah, so those are the three words I'll ask you to repeat back to me at the end of the exam, okay? Okay, so let's go ahead and, so for vitals, I would go ahead and start with the height and weight, which we've already taken. And then now I'm gonna assess for the temperature, the blood pressure, the pulse, the respirations, and the heart rate. So we've had an O2 hooked up to the finger, and his O2 is at 100%, so we'll go ahead and note that. And then we'll go ahead and start with a temperature, which was taken, and that's at 98.6. So next I'm going to I'm going to feel your pulse, and I would check the pulse for 1 full minute. Okay, you're at 95, and then next I would listen to heart rate for 1 full minute, and I'm going to be assessing for any bruits, thrills, crackles, murmurs, and any type of wheezing, any abnormalities that might indicate further assessment needing. So let me go ahead and listen to the heart. I'm going to listen for 1 full minute. Okay, good. Heart rate sounds good. Next, I'm going to take the blood pressure. And first, I'm going to palpate the radial pulse or systolic blood pressure. And then I'll wait 1 full minute, and I'll go ahead and do it again for a full reading. So right now I feel the pulse. And I know now. Alright. So I'm going to systolically move that marker all the way up to the 150. And now I've waited a full minute, and I'm going to go ahead and take the blood pressure now. Putting stethoscope on the brachial, making sure patient does not have their feet crossed. Good, 120 over 78. Excellent. Blood pressure. And you haven't had any history of low or high blood pressure?
No.
Okay, great. So vital signs, I would have recorded and then for breath sounds, I would put my hand over chest and count 1 full minute for respirations, breath sounds, and they would be between 12 to 20 breaths per minute for an adult. Okay, so I would document the height, weight, the blood pressure, the pulse, the respirations, the temperature, and the O2 sat, which everything is within normal range. So next I'm going to move on to, and also I would document the pain indicated on a scale of 0 to 10. Okay, so next I'm going to go ahead and move on to the head. And if you could just speed up a little bit, great. I'm going to inspect the scalp. I'm going to be looking for any protrusions or lacerations, any areas of thinning hair or balding where further assessment is needed. And this looks good. Everything's within normal. The scalp looks no extra dryness or anything like that. And then next I'm going to look at sinuses. I'm going to palpate. So I'm checking above the eyebrows. Any pain when I do this?
No.
No. Okay. Next I'm checking, I'm going to go ahead and check the rest since I'm checking for lymph nodes. I'm going to check for occipital, which is behind the head. So I'm looking behind, and then I'm going to go along the sternocleidomastoid all the way down to postocular. I'm palpating postocular, and then in front of the arcal for the preocular, and then tonsillar, moving down, submandibular, and then submental. And then I'm going to go down and I'm doing anterior cervical here, and then I'm doing posterior cervical all the way down, and then I'm doing subclavicular along the above the clavicle here. Okay, so any any tenderness or anything when I was palpating?
No.
Okay, great. So then next I'm going to move on to the eyes, and I'm going to go ahead and check for any abnormalities. I'm looking around. Eyebrows look good. No abrasions. No tenderness. Conjunctiva. None indicated. Sclera is nice and white. And then I'm running the light in to see for pupil perla. Pupils equal, round, reactive to light, and accommodation. That's central nerve 2. And then I'm going to go ahead and use the pen light to further test. Okay, so can you follow this light or the top of my pen light? Very good. And then I'm going to test for ocular motor movements. So what I want you to do is follow this light for cranial nerves 3, 4, and 6. Good. For purposes, I'm just going to do time purposes, I'm just going to do one side of the assessment, assuming I would have done both. Everything is nice and equal. There was no skipping or anything, and I could see the reaction. Pupils were equal, perla, and then now I'm going to inspect the ears. So the ears, I'm looking for color. I'm looking to see if they're once again, any abrasions, cracks, rashes, anything like that. I'm going to look inside the ear. Everything looks good inside. And then I'm going to be looking for any tenderness or draining from your ears or anything?
No.
No? Okay. And then, can you hear that?
Yes.
Okay, great. So I did the finger rub for acoustic for cranial nerve number 8. Okay, so now we've done the ear. I'm going to continue with hearing test, doing Weber test for demonstration purposes. My tuning fork is going to be the scissors, but so I'm going to test you could tell me. I'm going to tune it. I'm going to put it right in the midline. Do you hear a sound?
Yes.
Okay. And then put your finger up when the sound goes away. Okay. And then I'm going to do the same thing, and then I want you to put your finger up when you do, when you hear, that was lateralization. Now I'm going to do I did Weber, the Rhine test, and that's going to test the hearing on both ears as well. So, and it's just below right here. And then put your finger up when the sound goes away.
Second time.
Yeah. And go ahead and tell me when the sound goes away. Good. So, and you heard it equal in both ears?
Yes.
Okay, great. So that concludes that test. Next, I'm going to inspect your nose. Okay, I'm looking for around the nose. I'm looking to see symmetry of nostrils, making sure the nares are open. Have you had any problems breathing or anything?
No.
Okay. Mucosal, pink, nice, moist. No excessive fluids or drainage.
No.
Okay, so that looks good. And then can you close your eyes? Okay, can you tell me if you smell anything?
Yeah.
Okay, great. Yep, that was olfactory nerve. We were cranial nerve, and that was for number 1, olfactory. Okay, so great. So now we're going to be moving on to your throat and mouth. So I'm looking, let's start with your mouth. Go ahead and open your mouth. Great. I'm assessing around the skin, inside. I'm looking at the teeth. Teeth look good. All of them are there. Counted all of them. No abrasions of any sorts. Everything looks normal. I'm using a tongue depressor, looking back the uvula. Can you say ah?
Ah.
Great. And then stick your tongue out. Okay. And then resist. Okay, good. So that was for the gag reflex, cranial nerves 9 and 10. And then we also assessed 12 with the tongue for hypoglossal. And then next, since we're in the face area, go ahead and I'm going to test for cranial nerves 5 and 7. So go ahead and can you make a frown? Can you make a happy face? Can you raise your eyebrows? Can you stick your tongue out? Can you puff your cheeks? Okay, now can you resist against me on this side? And go ahead and resist against me on that side. Great. And then I'm going to look at your trachea for midline. Right here, I'm palpating. There's no deviation. Thyroid gland is normal. So I'm going to have you take a sip, and I'm going to be assessing your thyroid to make sure it goes up and down. So go ahead and then swallow. Good. It moved up and down. Okay, so next, I'm going to go ahead, since I'm right here, I'm going to look at your shoulders. Go ahead and can you shrug up? Okay, let me see. Do it one more time. Can you resist? Good. Spinal, and that was cranial nerve number 9, shrug test. Very good. So next we're going to continue on with musculoskeletal. And what I'm going to do is I'm just going to be testing range of motion at this time. So what I want you to do, we're going to do a series of movements. And if you could go ahead and raise your hands. Okay, bring them down, and bring them halfway up, all the way up, behind your head, behind your back, okay, and then go like this, and then bring it back, and then all the way up. Okay, next I want you to resist against me. Can you push up, push down, push side, and then inside, okay, and then go like this, okay. When I pull, there you go. Okay, can you squeeze both my fingers? Good, nice strong squeeze. And that was musculoskeletal. So we did range of motion exercise, or range of motion. Next, we're going to go ahead and do deep tendon reflexes. So what I want you to do is, if you could, I'm going to be assessing for all the joints. Can you go ahead and push your leg out? So I'm looking, he's doing the leg extension, and then I'm looking at, okay, same thing with here, push down, elbow, and it's at a 90 degree. Can you just make it like a L? 90 degrees, yep, up, down, okay, and then I'm doing the Babinski. Can you leave your foot out? And you can't really see, but I'm That tickles. Good. Okay. And so those were the deep tendon reflexes. We did the knee, we did the triceps, biceps. Good. So now I'm going to go ahead and I'm going to continue the assessment, and I'm going to listen to your lungs now. So I'm going to listen to front and back of your lungs, and I'm going to ask you to take some deep breaths. So for the lungs, I would have inspected the skin, making sure that everything is nice and smooth, no open wounds, no abnormalities of rashes or tenderness in any places of the skin. So let's go ahead and listen to your lungs. And I'm going to go ahead and listen in all. I'm going to start at the front. Take a deep breath. Okay, now I'm going to listen to your back, so go ahead and turn around. You could still sit. And I'm going to listen to all 6 places, so starting on the left. Deep breaths. Right. And then I'm going down and over, comparing each lobe. Clear to auscultation in all fields. Okay, next I'm going to go ahead and tap on your back, and I want you to tell me if you feel any tenderness when I do this. Tender?
No.
Okay, and one more time.
No.
Okay, great. Okay, so go ahead and turn around now. Next I'm going to listen to your heart now, and I'm going to auscultate in all for the apical, 8 to 9. Starting first with the apical. I'm sorry, aortic, pulmonic, which I'm hearing. Tricuspid. So, aortic, pulmonic, herbs, tricuspid, and mitral. And then I would turn the bell over, and I would listen for a full minute here. And I'm listening for S1, S2. I would be listening for Brewitt thrills, no heart murmurs of any sort. So next we're going to continue on, and we're going to do vascular, and I would have inspected, since I was in the front of the abdomen skin, the arms, the extremities, for any abnormalities, any bruising, bumps, moles that are new. And then I would do the other side, same with the legs. I would look, tibial line is medial here, looking at every area of that. Cap refill, let me go ahead and, good, it's less than 3 seconds, so cap refill is good. And then we would also just, at this time we could do Homans. So why don't you go ahead and lay down? Yeah, with your head at the base there. And then go ahead and put your legs down. And what I'm going to do is I'm going to perform Homans. So I'm squeezing the calf, and with this up, I should not feel any, there should not be any tenderness If it is, it's an indication of a DVT, and that would be considered an emergency, and we would go ahead and contact the physician at that point. So since I have you laying down, I'm going to now palpate the abdomen and see areas. So if you just want to lift your shirt a little bit, and I'm going to start with the right upper quadrant. Well, actually, you're right. And I'm going to just gently palpate, moving down to the lower left. Tickle, sorry. Don't mean to tickle. I'm going to auscultate. Was there any tenderness or anything?
No.
Okay. Let's auscultate. Right upper. And then here is the aortic, the splenic, it's on the right hand, your right, so aortic, splenic, renal, and then iliac, which is right down in here. Okay, so I've went ahead, I've palpated, and once again I'm feeling for any rebound tenderness, any abnormalities. Next, I'm going to do deep palpations of all 4 quadrants, and I'm going to palpate like for the gallbladder, which is on the right side here. And then, so I'm going to also, we're going to check for appendicitis as well. So what I'm going to do is I'm going to have you get on your lay on your left-hand side. Okay, just like that. And what I want you to do is raise this leg. Any pain?
No.
Okay, if there was pain, it would be, it would go ahead and be pain. It would indicate possible appendicitis. And then the other thing we could do is go ahead and lay on your back. Okay. Okay. Do you feel any pain when I palpate right here?
No.
No? Okay, so I would palpate to see if there's any inflammation or anything with appendicitis, and that would indicate appendicitis. Lastly, for the genitalia, rectum, I'm not going to go ahead and perform a demonstration, but I would want to be indicating if there was, first of all, privacy, making sure I have a new set of gloves, hand hygiene, and then I would make sure that I would be inspecting the perineum, the genitalium. We could do a breast exam, we could do a testicular exam, and then we could also do a digital exam as well for the rectum, for BPH. And then also I would be performing hand hygiene. And then lastly, I would want to ask my patient, can you remember those 3 words I told you to remember?
Cat, boat, and pen.
Awesome. And that concludes our assessment. Thank you very much.